As we all know, a tragic earthquake happened earlier this year in Haiti. I was fortunate to be one of the people who was able to see firsthand what was going on a couple weeks after the earthquake. And frankly, it was pretty overwhelming. And in particular, as a doctor, it was overwhelming to see what this was like for clinicians on the ground.
My personal admission rate's about 0.5% because there's nothing to do with most of these people. I mean, you get a DVT, we send them home. You get a stroke, we send them home, or send them to the street. There's only a couple beds to admit them to. This is triage at its original meaning, basic level. Send home the ones that are going to die anyhow. Send home the ones that are going to live anyhow. Try to take care of the few we can take care of.
So that was one of many doctors that's been in Haiti, and many more are there. Some of you probably know Enoch Choi from the Palo Alto Medical Foundation. He and others from his group and from Harvard's Operational Medicine Institute have been doing terrific work there. In fact, they've also gone above and beyond in trying their best to document the medical records that they're collecting using iPhones so that follow-up care can be as thorough and effective as possible. I happen to know that many of them spent late nights doing the documentation because it's so hard to do in real time. Someone who I've met, who I've developed a deep respect for, is Josh Nesbitt from Frontline SMS. And what he and many of his collaborators have done is build a SMS short code system, which means that any of us can send a message to this one simple short code wherever we are, and applied it to this situation in Haiti. And he's collaborated with Haiti and several other inspiring groups to really solve some important problems.
After the Haitian earthquake, Josh Nesbitt got in touch with Haiti with the opportunity to use the 4636 short code.
It was clear that Haiti wanted an SMS channel to allow people on the ground to report via their mobile phone what was happening. And we knew that Frontline SMS had been used to provide that local SMS gateway in the past. So I reached out to Frontline users here in Haiti. It became clear that we might have the chance to use 4636. It was exciting to have that short code secured, but at the same time, there was a real sense that we needed to be fully prepared, that there was responsibility if we were going to stand up this system, that we could respond.
The technical landscape was constantly changing, so we needed to have 24-hour support, working closely with engineers of the phone companies, as well as working closely with engineers of Haiti and Crowdflower and others.
Everybody's having problems because everything was happening so fast. So that was a 24/7 commitment by Instead, by Haiti, by Energy for Opportunity.
Part of the beauty in this is the collaboration between nonprofit organizations, private companies, the public sector, the U.S. government. Other partners include Crowdflower, which provides a microtask platform, and Samasource, which had linked up with 1000 Jobs Haiti here in Haiti before the earthquake to provide digital micro work. And we partnered with them because digital micro work can also be translation services. And we're now employing Haitians just outside Port-au-Prince to do that translation step.
So what happens is somebody sends a message to 4636. It gets routed through Instead, and it gets forwarded on to Crowdflower, where volunteers and people actually working in Haiti will translate the messages and forward it on to Haiti, and they're mapped so people can get spatial awareness for what's going on in an area.
Right now, Instead is doing two things for 4636. The first one is we're helping keep those connections alive to the phone companies. The second part is giving technical support to Thomson Reuters Foundation's EIS project, which is about giving information to the population in targeted ways to help them recover from the disaster faster.
The 4636 system uses a technology that's in the hands of billions and billions of people around the world. SMS really is the lowest common denominator and gives you a way to pull out the voices of people from the ground in the good times and the bad, including crisis situations. So this is certainly a system that can be replicated and can be useful in other cases.
We learned a lot during this event. The challenges are rarely technical. In this case, I think the biggest takeaway is a network of trust that has formed between Haiti and Instead, Samasource, Crowdflower, Frontline SMS, and all the other participants. We know that when the next crisis comes through, we'll do a much better job faster.
So So I was part of a team from Google that went to Haiti a couple of weeks after the earthquake, and Google got involved to see what kind of tools and information resources we could provide that might be helpful. Many people actually were asking us if we could provide some kind of online medical record system, given that in many cases records are being kept on cardboard, on the ground. But when we arrived in Haiti, there were much simpler and more important problems. A couple of the things that we saw, for example, were a woman who needed an emergency C-section, and the doctors had to drive her 40 minutes across town because they didn't know of closer by OBGYNs who were available. So the issue of where to send people, where to transfer people, a very simple resource matching problem was the one that became clear that we might be able to help with. And so what we've been doing in collaboration with some of the health agencies and NGOs is building something called Resource Finder. So Resource Finder will be a very, very simple application. All the hospitals in Haiti will be listed here, and you'll be able to look at all of them or restrict to a certain specialty. So let's say you need an orthopedist. See the orthopedic hospitals, see where they are on the map, and drill into details, for example, to see that this one does currently have bed availability, and see what the phone number is to call if you want to transfer a patient. And this information is being populated in collaboration with several NGOs and the Ministry of Health, and it will be updated in real time by people on the ground and several of those agencies. Many people have been understandably overwhelmed by this situation. When my team was there, we were sleeping at what used to be a country club, and the golf course has since become a refugee camp with many tens of thousands of people staying there in this tent city. And every night at 6 o'clock, they have a church service. There's no church anymore. These people are so hopeful and so grateful and so alive that there's really no bigger motivation for doing the kinds of work that so many people are doing than reflecting on how these people look at the world.